Today we're going to talk about massage for dogs, or more specifically, how to treat trigger points that may cause pain in your young or old dog, especially a dog that might have some previous injuries. Hi, I'm Tanya Costa. Welcome to Canine Wellness Online. Have you ever run your fingers down your dog's back and all of a sudden you see some quivering? This is a common question I get from clients in my office. And this is usually nothing more than trigger points. For lack of a better term, trigger points are basically knots in your dog's back. It can be in the shoulders. It can also be in the hip area, but mainly most owners notice them in your dog's back. And these may cause some discomfort or pain. These are common in young, active dogs on a day like today where we just had 2 feet of snow and your young dog is running around in the backyard. So let's dive into how you can assess them and how you can treat them. So the first step is being able to locate where the trigger points are. So before you start doing any kind of massage work, it's best to make sure you're in a comfortable spot. I'm sitting here, I have a pillow against the wall or the radiator to make sure that I'm using my body properly. And have your dog on a nice mat and in a quiet area of the house. If you have children or other dogs, put them away because you want this to be a great experience for them and have them to be as relaxed as possible. And first, what you're going to do is warm up the tissue. So you're going to take your hands and try not to use your fingertips. It's very easy for a lot of people to think, okay, this is me massaging my dog. And actually, there is a place for doing that kind of thing, but that kind of tends to stimulate the dog and not relax them. So what I want you to do, it's a simple stroke called Effleurage. And basically what you're going to do is use from here to here, the flat part of your hand, and we're going to move my doggy closer to me. And if you're a 100-pound dog, you won't be able to do what I just did. And basically what you're going to do is take your hands, and it's best to always make sure that you keep one hand on your dog and just moving. I know you're getting all comfy. Moving your hands down. Now he's lying on one side, so once I've done this side, I can move to the other side. And all I'm doing is spending a few minutes kind of warming up the tissues, getting the blood flowing so I can get him ready for me doing the trigger point. And he's just been running out in the snow himself, so I will probably find lots of trigger points. So I might spend 2 or 3 minutes just doing this nice and slowly, bringing my hands down. And again, I'm not using my fingertips. I can go all the way down and down the legs. And then I can come along the shoulders, down, and down. What I want you to do is for the head and neck area, which is really an important area in the dog, is just have your hands and kind of cup underneath their jaw and just nicely, gently moving this way. This is their TMJ. And just gently, again, going sideways, 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 whatever is easiest for you, and you maintaining good posture while you do it, because I can tell you after 24 years of doing this, my back is toast, and we don't need to do that right now. We can save that for off camera. So now to assess trigger points, you're going to run your fingers down. Here's the nubbly bit up here is called their spine, and you're going to run your fingers down, and what you're going to find, see in there, see how the skin is quivering? So there's a trigger point in there, and usually the trigger point, the quivering will be below where the active spot is. So if I run my fingers down, and if they move away, he's moving away because the treats are behind me, but if they move away and do that repeatedly, you may be going too hard, or there may be something going on that you want to be careful about. So what you're going to do is you're going to take these 2 fingers and you're just going to run them. Unfortunately, I can't keep good body language because my dog keeps moving. But what you're going to do is, here's his spine, the nubbly bits up here. This is his thoracic spine and lumbar spine. And you're going to take your 2 fingers and you're going to run them down, and right there. Let's see if we can get a trigger point going right there. I think the best way to describe the pressure is you go gently. If you don't feel anything, then go a little harder. It's kind of like the pressure you would use, right there. So he's got a number of trigger points in the lower part of his back, so his lumbar spine. And what I'm going to do is when I hit that spot, and this is the time when you are using your fingertips, it's easier to find them. And when I get here, oops, right there, there's a trigger point right there. So what I'm going to do to treat it is I'm going to push my finger on it. I prefer to use my index finger, not my thumb. And when I hit that spot, it's going to quiver. And he's a little bit uncomfortable. I would say that it's not as much painful as if you've ever had someone work on a knot on yourself. It kind of feels like spiders crawling down your back. And I think dogs just don't know how to deal with that. So I'm just going to gradually dip my finger in. Now he's starting to close his eyes. And he's kind of digging this. He's like, oh, thanks, Mom. And I'm going to hold it there for about 30 seconds. And I'm not really doing anything. I'm not pushing down hard. I'm just, when I hit that spot, and now it's not there anymore. So let's see if we can find another one. And again, we'll go this way. Now, typically when I do treatments on dogs, I do it standing with them on a table, but I'm doing it this way because this is how most of you will be doing it on your dog. See, usually you'll find a lot of them right behind their scapula here, especially in senior dogs. I see most of my senior dogs, this area in here is the most reactive. So if I move, you'll feel this kind of curvy bit, that's his scapula. And when I go down here, you probably can't see it on the camera, there's just a little bit there. And he's pretty young, he's only 7.5. But on your dog, when you see the skin quiver, right there, I'm just gonna hold this in there and gradually just put a little bit more pressure, a little bit more pressure, a little bit more pressure. I mean, I'm not digging, I'm not trying to scrub it. That's a whole other technique, which I wouldn't recommend doing unless you know what you're doing. And holding it for 30 seconds and then releasing. And then again, I'm gonna go up here, see if right there. That's a good one right there, hey buddy? So his eyes are open. Now when I'm pressing, he's closing his eyes. Now, if you're doing this and your dog starts to really fight you, or you're doing it and they're turning their head towards you, you're going too hard, too fast, or there may be an issue there that you're not aware of. Because it really should be comfortable for your dog. Like right there, I was probably a little too hard for you. A little hair on your nose. And then we can do the neck as well. I find this area for owners is a little harder because there's so much with their shoulder there. There's so many muscles up and around here, obviously, to keep their head where it is at. And we got one right in there. And we'll just go in there. And when you're doing this, please don't do it underneath up in this area. And the reason for that is you don't want to get into their jugular and their major arteries in there, unless you know exactly where landmarks are. And you also don't want to do bony prominences. And what that means is this is the head of his shoulder. So this bony bit, there won't be trigger points. There may be ones around it. Let's see, he doesn't have any. If I had an older dog here, he's not with me today, but he has tons of them going all the way down. And the reason you see so many this way is because this is his latissimus dorsi, which connects the front really to the back. A second way that you can work on these trigger points is when you find a trigger point, when they're lying down or standing, is if the trigger point is right here, let's say, well, it's still there, right there. What you can do is, in this case, up here, you can take his front leg while you're holding it and just stretch his front leg a little bit. And what you're going to feel under your finger, and you can use 2 fingers too if you find that easier. And you're just going to gently press into it and stretch out that leg. So it's more of an active, working on an active trigger point. And the same goes here. Like often you'll see trigger points in this area around here, which is part of the iliopsoas complex. And what you can do is, if you find ropey, taut, ball kind of knot thing, you can take your fingers and put them there and just try and gently, see how slow I'm going? If you go quickly, they're gonna they're gonna get up. But I'm just really slowly stretching out this leg, and I'm kind of holding down that little trigger point and getting the muscle to lengthen. The third way that you can do this is my video here. I did a video on puppy pinches or skin rolling. So that's another way that you can get some of these trigger points if your dog is not digging this type of way of doing it. Now, when you've finished your doing your trigger point work, it's always best, I think, to end with some of that effleurage again, and just again getting some of that blood flow to the area, helping move everything down, move it down. We don't need to clean ourselves. Moving it down, down, and then we can move it back up against the fur. And again, I'm not using my fingertips. I'm moving up for 2 or 3 minutes just to end the session. And as I mentioned in the beginning, always make sure you have at least one hand on your dog until you're finished. And another important thing is, when you're done, you really should give your dog access to water to hydrate. It really helps with the tissue healing. Just a tip for you, you shouldn't be doing this every single day. You need the time for the tissues to accept the work that you've been doing and let them relax for about 48 hours, so 2 days, I would say. So you could do this a few times a week. I hope you enjoyed this video, and remember, this is meant to be calm and relaxing for your dog. So if you're not in the right spot or in the right headspace, your dog is not going to be in the right headspace. So see you in the next video.